British Prime Minister Theresa May is expected to challenge the National Health Service, health charities and artificial intelligence developers to work together in order to transform how chronic diseases are diagnosed. It is expected that a national database will cross-reference patients' medical records, habits and genetic information to spot any early signs of diseases. Downing Street's claiming the groundbreaking technology could see at least 50,000 people every year diagnosed at an early stage of prostate, lung or bowel cancer. Experts say it could be used to prevent 22,000 cancer deaths by the year 2033, while aiding the fight against heart disease, diabetes and even dementia. Dr. Tim Sandle is a pharmaceutical microbiologist who believes this is a key initiative going forward.
Well, I think first of all, it's a really good initiative. The key problem is about the late diagnosis of cancer, and the argument of using artificial intelligence is to identify those members of the population who are at greatest risk, and then to bring them in earlier for screening. The focus is particularly with prostate, lung, and bowel cancer. Well, I think it's about catching people at risk earlier, and then you can undertake procedures like surgery or administer treatment sooner in order to be able to increase survival rates. What the NHS has at its disposal is an enormous database of information. So there are things like genetic profiles from patient records and screening people for lifestyle, and about getting those people in sufficiently early in order to allow medical treatment to happen sooner. And it's the artificial intelligence that accelerates that process.
The Prime Minister is also set to pledge that its development will create high-skilled science jobs. According to the charity Cancer Research UK, there were more than 166,000 deaths in 2016 due to this disease. And Theresa May will say the late diagnosis of otherwise treatable illnesses is one of the biggest causes of avoidable deaths. And Dr. Sadler is confident that the artificial intelligence will be helpful across the board in diagnosis.
Okay, well, I think that there's two waves of artificial intelligence. The first one is been able to interpret databases. So the NHS has built up a huge library of information about patients over the years, and this contains information about like their health status, their body mass, their genetic profiles, and to be able to plough through these millions of data points does take machines to do that. And over time, the technique of machine learning means that the more cases that the intelligence gets right, then the better it becomes going forward. But there are other types of artificial intelligence that can also improve the detection of tumours and looking at things like MIR scans and so on, and been able to detect different types of tumours early. Because cancer is very complex. There's already been identified at least 300 different types of tumours. So been able to screen those and find the right platform to do that. And this is all something that it doesn't take away the job of the medical professional, but it enhances the job of the medical professional.
Cancer Research UK is a charity that's backing the plans that the Prime Minister is due to set out later today. And they believe it's pioneering, and the advances in detection technology depend on the intelligent use of data and have the potential to save hundreds of thousands of lives every year. Mrs May's speech is expected to set out specific details for cancer, but also a range of chronic diseases, including heart disease, diabetes and dementia. It's estimated that 1 million people in the UK will have dementia by 2025, with projections from Dementia UK suggesting that this will increase by 2 million by 2050. Dr. Sadler understands that there will be criticism from this announcement, but also that there has to be an eye on how beneficial it will be in the long term.
I think healthcare is always going to require lots of money, and I think the job creation thing is important, but to me it's a secondary thing. I think in a general thing that society is changing, the types of roles that people will be performing, and the way they engage in technology, the whole digital transformation of health is a subject in itself. But I think what this is doing, it's all about we detect diseases early, because it's not just cancer, this also extends to things like cardiovascular screening and so on. If the earlier we detect things, the earlier we can administer treatment, the greater the survival rates, but also the reduction of burden on the NHS going forwards. You have fewer people in hospital, fewer palliative care, and so on. So it's I can see why some people might question it, but to me it's about spending now to save costs for the future, and this is all about increasing patient survival, which is surely what everybody wants at the end of the day.
Mrs May will also use her speech to announce a new target to ensure that 5 more years of people's lives will be healthy, independent and active by 2035. Jordan Brooks, Radio Sputnik.